Hey, it's Dr. Kyle with All About Chiropractic. Today I want to talk about sciatica. And if you're currently experiencing sciatica, you probably know exactly what it is. And for those of you that don't, it would be if you're having any numbness and tingling, sharp shooting pain on the back of your leg. Sometimes it doesn't even make it to the leg. It'll be in your butt, or it'll go down the back of your leg. It might go past your leg all the way down into your foot. But just so you know, it's not normal. And it's definitely something that we can work to correct and to get rid of. And when we talk about the sciatic nerve, it's actually one of the biggest nerves in your entire body. It's about the size of a pen. And so that's a big nerve bundle coming out of that low back to power your low back. But then as well, it's going to control digestion. It's going to control the large intestine, reproductive organs. It's going to control your bladder. And so when you take a look, if that is going on right now, if you're having some of those different symptoms, some of those different issues, first thing you want to look to is the spine. We want to look to see, is there something putting pressure on this nerve that comes out of that low back causing that shooting pain down your leg? And majority of the time, it's a combination of things. And what I mean by that is we're going to have what's called a subluxation, which is a bone that's misaligned, putting pressure on that nerve. That bone can tip one way versus the other, but anything that puts pressure on that nerve is going to cause that shooting pain down your leg. And if it's causing an issue to the point to where you're having a hard time walking, having a hard time getting your foot to move, that's a really severe case. And so we need to figure out exactly what's going on there. If there is pressure specifically on that nerve, we need to get it off of there. And how we do that is before we actually treat the spine, we want to do the work to figure out exactly what's going on. The last thing you'd want me to do is to guess. If you were to go into your dentist to have your teeth worked on, but he didn't do any testing and you just started putting fillings in your teeth, it's not going to be a very good outcome. And the same thing when you go to a chiropractor. When you come in to see me, I'm going to take pictures. I want to see the x-rays. I want to see exactly what's causing the issue so that way we can correct the cause of the problem and to get rid of it for the long term. And so when we sit down, we're going to set goals. We're going to see what specifically the low back sciatic pain is doing, what it's affecting, if it's affecting your ability to go for a run, if it's affecting your ability just to sit in a chair or get up and down from a chair, or even walking where you find yourself leaning forward or leaning to a side. We definitely have a disc issue. We have a sciatic problem in that low back and we need to address it. And so we're going to take x-rays to see exactly what's going on. You and I are going to sit down and go over them. Because ultimately it's your spine, you deserve to know what's going on there. And so we'll go through and we'll be able to see that bone that's misaligned. We're going to be able to see if we have hip imbalances from left to right. And then we're going to do a functional movement screen to see how the body is moving and correcting, how it's functioning. And as your body starts to improve, once we start treatment and we put a course of a correction and plan, the cool thing is we retest everything. I want to see the corrections. So if we see those subluxations in the spine, we see those rotations, we see that we have a hip imbalance or curve in the spine, when we take another set of pictures eventually down the road, we want to be able to see that correction. We want to see that the hips are leveling out and the spine's doing what it needs to do. And then we're going to look to see if those muscles are performing how they're supposed to be. Are you able to walk normally? Can you do a squat? Can you do a sit-up? Do we have the same flexibility in your left hamstring as your right hamstring? All those things are super, super important because at the end of the day, that's what's going to affect our quality of life as we get older. And so if you're sitting there dealing with those issues right now and not knowing what to do with them, I think it's time to schedule an appointment and get in. It's time to have somebody actually take their time to sit down, spend a half hour to an hour going through what's causing the issue, find the problem, and ultimately put together the correct plan to correct it for the long term. The last thing you want is for the pain to go away and then to come right back. And so I refer to that as like a yo-yo effect. We get the pain to go away, it comes back, it goes away, it comes back, and ultimately we're not truly correcting the cause. If we can strengthen the muscles up that are holding the spine in the position that it needs to be, the yo-yo effect is not going to happen. The problems are going to go away and they're going to stay away, and ultimately that means for you that quality of life is going to be better. You're going to be able to do the things you want to do, train the way you want to train, and just live life to the fullest and not have to worry about when the next time I bend down to pick up a Q-tip, my back's going to go out. And so any of this going on for you right now, the link below, click on it. Schedule an appointment. I'd love to sit down and talk to you. I'd love to set goals specific to what you have going on. So ultimately, I know how I can best serve you to get rid of the issues that you're currently dealing with. Or you can give the office a call. The phone number's there as well. Give us a call, set up a time, let's go through and figure out how we can help you get back to living the life that you want to live.